Welcome back to Anatomiqa. In this session, we will discuss the details of gross anatomy on pancreas. The learning objectives of this session are: identify anatomical position, external and internal features of pancreas, explain important peritoneal and other relations, blood supply, nerve supply, lymphatic drainage of pancreas, and correlate clinical aspects of pancreas. Pancreas is a soft, finely lobulated, elongated exo and endocrine gland. The exocrine part secretes the pancreatic juice and the endocrine part secretes the hormones, namely insulin, etc. The pancreas in Greek is pan means all, krias means flesh. It is presumably so named because of its fleshy appearance. The pancreatic juice helps in digestion of lipids, carbohydrates, and proteins, whereas the pancreatic hormones maintain glucose homeostasis. The pancreas lies more or less horizontally in the posterior abdominal wall in the epigastric and left hypochondriac regions. It crosses the posterior abdominal wall obliquely from concavity of the duodenum to the hilum of spleen. The greater part of the gland is retroperitoneal, behind the serous floor of the lesser sac. Its left extremity, the tail, lies in the linorenal ligament. The pancreas is deeply located in the upper part of the abdomen and hidden by many organs, hence not accessible for physical examination. The pancreas is J-shaped or retort-shaped, being set obliquely. The ball of retort represents its head, and the stem of retort represents its neck, body, and tail. It measures around 12 to 15 centimeters in length and 3 to 4 centimeters in width. Thickness is 1.5 to 2 centimeters and it weighs around 80 to 90 grams. For descriptive purposes, the pancreas is subdivided into 4 parts: head, neck, body, and tail. Head is the part which is within the C-shaped duodenum. Observe the uncinate process arising from the lower left part of the head in the video. Neck lies in front of formation of portal vein. Body extends from front of aorta to the front of left kidney and is triangular on cross section. Tail extends between 2 layers of linorenal ligament and reaches the spleen. Head of the pancreas is enlarged disc-shaped right end of the pancreas, which lies in the concavity of the C-shaped duodenal loop in front of the first lumbar and second lumbar vertebra. The head presents the following external features: 3 borders, superior, inferior, and right lateral. 1 process, uncinate process, which is a hook-like process. From the lower and left part of the head, it extends towards the left behind the superior mesenteric vessels and in front of aorta. The 2 surfaces are anterior and posterior. The superior border is related to the first part of the duodenum and superior pancreaticoduodenal vessels. The right lateral border is related to second part of the duodenum and anterior and posterior pancreaticoduodenal arterial arcades. Inferior border is related to third part of duodenum and inferior pancreaticoduodenal vessels. Anterior surface is related to transverse colon in the upper part, root and inferior layer of transverse mesocolon, and coils of jejunum in the lower part. Posterior surface is related to inferior vena cava, left renal vein, bile duct lying in a groove and may be found embedded in the pancreatic tissue. Neck of the pancreas, it is slightly constricted part of the gland which connects the head with the body. It is about 2.5 centimeters long and is directed forward, upward, and to the left. It presents the following external features: 2 borders, upper and lower, 2 surfaces, anterior and posterior. The upper border is related to the first part of the duodenum. Lower border is related to root of the transverse mesocolon. Anterior surface is related to pylorus. Posterior surface is related to commencement of the portal vein and origin of the superior mesenteric artery. Body of the pancreas. It is the elongated part of the gland extending from its neck to the tail. It passes towards the left of midline with a slight upward and backward inclination. It lies in front of the vertebral column at or just below the transpyloric plane. It is somewhat triangular in cross section and presents three borders: anterior, superior and inferior borders, three surfaces: anterior, posterior and inferior surfaces. One process, tuberomental. A part of the body projects above the lesser curvature of the stomach and comes in contact with the lesser omentum across the lesser sac. Anterior border provides the attachment to the root of the transverse mesocolon. Superior border is related to the celiac artery above the tuberomental, hepatic artery to the right and splenic artery to the left of the tuberomental. Inferior border is related to superior mesenteric vessels at its right end. Anterior surface is concave and directed forward and upward. It is related to stomach and lesser sac between the two. In the video, observe the anterior relation of the stomach to the body and transverse colon to the head of pancreas. Posteriorly, observe the bile duct forming from cystic duct and hepatic duct and passing towards second part of duodenum. Posterior surface, which is devoid of peritoneum, is related to aorta, origin of superior mesenteric artery, splenic vein, left kidney and left suprarenal glands. Inferior surface, which is covered by peritoneum, is related to duodenojejunal flexure, coils of jejunum and left colic flexure. Tail of the pancreas is a narrow left extremity of the pancreas. It extends between the body and the visceral surface of spleen. It lies in the lienorenal ligament along with splenic vessels. It is mobile, unlike the major retroperitoneal part of the gland. Coming to the ducts of the pancreas. Usually there are two ducts, main and accessory pancreatic ducts, which drain the exocrine secretion into the duodenum. Main pancreatic duct of Wirsung begins in the tail and traverses the whole length of the gland near its posterior surface. At the neck, it turns downward and then to the right to enter into the second part of duodenum. It joins the bile duct as it pierces the duodenal wall to form the hepatopancreatic ampulla of Vater, which opens by a narrow mouth on the summit of major duodenal papilla 8 to 10 centimeters to the pylorus. It receives tributaries throughout its length at right angle to its long axis in a herringbone pattern. It is the only duct in 90% of cases. Accessory pancreatic duct of Santorini begins in the lower part of the head in the uncinate process and then runs upward, cross in front of main pancreatic duct and runs medially to open into the second part of duodenum on the summit of minor duodenal papilla about 2 to 3 centimeters above the opening of main pancreatic duct, and it is 6 to 8 centimeters distal to the pylorus. In 40% of cases, it communicates with the main duct while crossing it. Coming to the blood supply. The pancreas is a highly vascular structure and is supplied by the following arteries. It is supplied by the branches arising from the celiac trunk and superior mesenteric arteries. The celiac trunk supplies pancreas through the branches of hepatic and splenic arteries. The hepatic artery gives rise to gastroduodenal branch, which in turn gives rise to superior pancreaticoduodenal artery. The superior mesenteric artery gives rise to the inferior pancreaticoduodenal branches. Both superior and inferior pancreaticoduodenal arteries divide into anterior and posterior branches which run between the concavity of the duodenum and the head of pancreas. The anastomosis between anterior and posterior branches form anterior and posterior pancreaticoduodenal arterial arcades and supply the anterior and posterior surfaces of duodenum and head of pancreas. The rest of the pancreas is supplied by splenic artery. It is the main source of blood supply to the pancreas. Its branches supply the body and tail of pancreas. It gives off several branches in its course which supplies the pancreas. There are very few named branches. Dorsal pancreatic artery arises near the neck, gives off transverse pancreatic branch which runs at the lower border of pancreas and supplies the lower part of body and tail of the pancreas. Arteria pancreatica magna is a large branch which arises near the tail and runs towards the neck, and a small branch called arteria chordae pancreatica runs towards the tip of the tail. These are the arteries which supplies the pancreas. Coming to the venous drainage, the veins of the pancreas accompany the arteries and drain into portal vein, superior mesenteric vein and the splenic vein. Lymphatic drainage. The lymphatics from the pancreas follow the arteries and drained mainly into the following groups of lymph nodes. Pancreatico-duodenal nodes present along the superior and inferior pancreatico-duodenal arteries, superior mesenteric nodes around the superior mesenteric artery, pyloric nodes and pancreatico-splenic nodes, which is the main group. All these drain into celiac nodes. The pancreas is supplied by sympathetic and parasympathetic nerve fibers. The preganglionic sympathetic fibers arise from 5th thoracic to 9th thoracic segments of spinal cord and relay in the celiac and superior mesenteric plexus. The postganglionic fibers arise from these plexus and supply the pancreas. The parasympathetic fibers arise from the right and left vagus, which passes through the celiac and superior mesenteric plexus and relay in the pancreatic tissue. The postganglionic fibers arise and supply the pancreas. The sympathetic is vasomotor, whereas the parasympathetic supply controls the pancreatic secretion. Coming to the last part, that is the clinical anatomy of pancreas. The carcinoma of the head of pancreas is common. It compresses the bile duct, leading to persistent obstructive jaundice. It may press the portal vein or may involve the stomach due to their close vicinity to the head of pancreas, which can be observed in the video. Acute pancreatitis is the acute inflammation of the pancreas. It occurs due to obstruction of pancreatic duct, ingestion of alcohol, virus infections or trauma. It is serious condition because activated pancreatic enzymes leak into the substance of pancreas and initiates the autodigestion of the gland. Clinically, it presents as very severe pain in the epigastric region, radiating to the back, and the other symptoms are fever, nausea and vomiting. Annular pancreas is a developmental anomaly in which a ring of pancreatic tissue encircles the second part of the duodenum. It may compress the second part of duodenum. Thank you for watching.